Hello everyone, here to talk with you today about social media, new technologies, and the future of health survey research. This paper was originally presented at the 10th Conference on Health Survey Research Methods. I'm Craig Hill. I'd like to acknowledge my co-authors Joe Murphy, Elizabeth Dean, and Ashley Richards, all of whom are younger than I am, it should be pointed out. We all are at RTI International. Back in 2004, Roger Tourangeau noted that survey practice is a kind of bellwether of social and technological change. I'm here to tell you today, at the risk of opprobrium from Roger and my colleagues, that I think this is no longer true, that the pace of technological change now is so rapid that we are having, in survey research, a difficult time keeping up. We wanted to illustrate this point by a couple of quotes from popular music. Back in 1976, the Nerves, a band, published a song, the lyrics for which said, "I'm in the phone booth, it's the one across the hall. If you don't answer, I'll just ring it off the wall. I know she's there, but I just had to call. Don't leave me hanging on the telephone." Of course, a perfectly normal reference to phone booths back in 1976. In 2010, another band, Arcade Fire, published a song with these lyrics. "It seems strange how we used to wait for letters to arrive, but what's stranger still is how something so small can keep you alive." Part of the point we want to make today is that it is these small communications amongst individuals, friends, family members, etc., that keep us alive. Ed Sondick, in his opening remarks for this conference, noted that this is the best of times for health data. In some ways that depends on your perspective, and it may indeed be the best time for health data, but it is an interesting time to be conducting health surveys. Survey research is buffeted by a couple of very large problems now, one of which of course is response rates, as indicated by this graph of several large federally funded health surveys. Response rates have been falling for quite some time now. There are lots of reasons for that, including mistrust and reluctance on the part of the population, the general public, to share their data with us. They are inundated with telemarketing, junk mail, caller ID. We have much more problems with controlled access now in the field than we used to, for example. All of these are contributing to falling response rates. In addition, we have coverage issues to deal with. Here is the much-loved and well-known Stephen Bloomberg graph from NHIS depicting how many people have now cell phones only, or cell phone mostly. Back in 2003, when this data series started, or what my teenage daughters refer to as the olden days, virtually no one had a cell phone. Now, of course, a quarter of the population in 2010 is cell phone only. And that is geographically quite different, as depicted in this particular map. Several states have populations that are cell phone only of greater than or equal to 30%. And of course we know too that there are quite a few demographic differences as far as cell phone coverage goes. We know that landline coverage is much lower for low-income adults. And in fact, several survey researchers now make the point that telephone numbers can no longer be relied upon for survey sampling in the RDD, even list-assisted RDD kind of technique that we've been using for quite some time now. Address-based sampling is one method that can help using lists of household addresses for mailing, but there's lots of work we need to do with that as well. So what about those social network kind of things? Maybe we can use those to help us move forward and get past these kind of problems. Can we use Facebook or Twitter or LinkedIn? Can we use Skype or MySpace, for example? So let's talk a little bit about these social media platforms. We'll focus on three in particular. Here's a map of online communities, a way of depicting the way the landscape looks nowadays as far as social media goes. That landscape dominated, of course, by Facebook and its satellite states, Farmville, Happy Farm. Twitter is growing, YouTube is growing. We as survey researchers are stuck down here somewhere in the storm-tossed sea of opinions. Well, let's talk a little bit more about Facebook in depth. Facebook is one of the most popular networking services, used to share information about oneself, such as your hometown, your current city, education, employment, interest, your favorites, things you like. Users can post photos and videos, notes. They provide status updates that are visible to other users. Facebook can also has an instant messaging capability, for example, and so when your friends are online, you know about that and can use the IM feature in Facebook to chat back and forth with those friends. In 2004, as famously depicted in the movie Social Network, Facebook broke the 1 million user barrier. But now, in 2010, we know that Facebook has over 500 million users. That coverage, of course, has some demographic differences. It is heavily populated by younger folks, of course. 73% of folks in the 18 to 29 range have a Facebook account. That's comparable to the landline coverage issues that we were talking about earlier. Facebook users are predominantly higher educated. It did, of course, start out as a way of connecting college students with each other. And Facebook users are generally more wealthy or have higher SES than the general population. Well, what are some of the ways that Facebook could be used for health survey research? We already use Facebook for tracing. We use it for ad health and some other surveys when other methods fell short. We don't try to friend people, but we do set up a page for the project and use Facebook's messaging system to try to locate individuals on a longitudinal surveys, especially when the person's name is known to us. Could you use Facebook? Could you develop a sample frame on Facebook? Well, there isn't a frame of users yet, although there have been some attempts to compile a list of names. There is much more work that needs to be done before we could actually use Facebook as a sampling frame. There are, however, lots of surveys conducted on Facebook. One example is a company called MyType, which has conducted over 700,000 surveys. It's a short online, of course, instrument that returns to you when you've completed it a personality type. And interestingly to us, 1 in 7 of those respondents chosen to post the results to their page. In other words, sharing the results of the survey they've taken with other Facebook users. There are, of course, several things to consider when we want to think about whether or not we could use Facebook for health surveys. We could use it for recruitment, for qualitative pretesting. We have done quite a bit of work using Craigslist, for example, as a way of recruiting focus group members, pretesting participants. Facebook could be used in the same way with a much larger audience. Facebook also can be used for registry applications, and in fact already is. It's the web of friends connected with each other is almost perfect for a registry application. And so, for example, the government of Malaysia's transplant registry is on Facebook. The National Cord Blood Registry in the United States has over 15,000 likes. Those are good examples of registry applications. There are some privacy concerns too. Facebook is somewhat infamous or notorious for changing often its privacy policy and making its users sort of keep up with what Facebook is doing as far as the what it allows to be done with its data. A lot of the work that we'll talk about a little bit later, screen scraping, sentiment analysis, for example, scrapes data off of Facebook users' pages without their knowledge, and so there are some privacy concerns that we as an industry will need to face. What about Twitter? Also a well-known social media platform. We have about 190 million people who use Twitter, a microblogging service in which you can send messages of 140 characters or less to followers. That those tweets get posted on your page and the page of all of your followers. Researchers are in fact starting to harness Twitter and what it does. A couple of examples here. One is diaries. Here's a very good example of a diary application using Twitter called Tweet What You Eat, in which Twitter users post daily what they consume and the amount of calories and so forth. The founder of this particular application notes that this seems to work quite well because of the element of shame involved. In other words, putting out for everyone to see, or all of your followers anyway, what you're eating each day and the calories associated with that should have a beneficial effect for you. Here's another diary example called Quitter, working essentially on the same principle in which smokers enter tweet essentially every time they have a cigarette, and those smokes get counted. You can also use Twitter in a passive way to supplement survey data. In other words, the screen scraping approach that I mentioned before. If you were, for example, we did this for this paper a short time ago, to search the Twitter stream for the keyword flu shot, you get returned as a data set all of tweets that contain that keyword. Here's just an example of what we see. You can then do content analysis or sentiment analysis to see what people in the moment are thinking about, writing about, posting about, tweeting about as far as flu shots go. So in that way, you can use Twitter to track emerging health issues. The big benefit there, of course, is that it's very near real time. Another slightly different example of social media is called Second Life. Second Life is a virtual 3D world in which users, referred to in Second Life as residents, create an avatar of themselves, a virtual representation of themselves and their characters. We have built a building in Second Life, we being RTI. You can see the lobby of our virtual building here. Here's one of our employees welcoming a guest to our facility. She has come in response to some advertisements we've posted in Second Life about trying to find people who are interested in doing surveys. So this participant has come and is getting instructions from our employees about how to do a survey in Second Life. She's going to be teleported in just a moment. There she goes. Since she's agreed to do a survey, she's going up to a private facility where she'll meet with an interviewer. One of the benefits of Second Life is that, as you'll see shortly here, the transcript of the interview can be captured for later analysis. Second Life acts in many ways as a virtual laboratory for us. We can do experiments, for example, in which we alter the size of the interviewer or the skin color of the interviewer or the shape of the interviewer. We can even make the interviewer a non-human form, for example, to test the results of interviewer-respondent interactions. There are, of course, many other social media platforms and other technological changes coming that have an impact on health survey research. Here are just a few examples that we'll talk about briefly. Skype is one example of voice over internet protocol communication system run on your computer that allows you to chat both video and voice with people you know. And again, the transcripts are captured from those sessions. Google Trends is another interesting example where you can analyze search terms, search keywords that people are using, again, sort of in real life. This graph shows that back in 2008, at the H1N1 outbreak, Google Flu Trends was actually a couple of weeks ahead of the published CD reports as far as incidence of flu. The two lines track quite nicely together, but as I mentioned, Google Flu Trends appeared to be about 2 weeks ahead of the CDC collected data. And of course, we want to make note of the fact that all of these technologies are available in a mobile way. Smartphones are taking over the world, one might say. I just saw some data from Yahoo earlier this year that said that the percentage of Americans who can access the internet using smartphones or other mobile devices is expected to grow from 39% in 2010 to 59% in 2014. And in fact, another study by Morgan Stanley said that by 2014, more people will access the internet on a mobile device than from a desktop PC. And of course, you can do surveys on mobile devices, sort of classic surveys. Handheld surveys surveys on handheld devices quite common at RTI. We've done over 3 million of these. There are some privacy and safety concerns, but we've largely been able to overcome these. So there have been a lot of changes in the last decade, and we wondered how it had shifted the focus of health survey research. So here's a word cloud representation of content analysis we did on the program from the 7th Health Survey Research Methods Conference, which was conducted in 1999. You can see, of course, that national results, data, methodological considerations were frequently found in the program in 1999. So was the word telephone. That was a large concern in 1999, how we were going to collect health survey data over using the telephone. If you move ahead to the 10th conference this year, again you see the words national and data being very large, research of course very large in the 10th program. We don't see the word telephone at all. Instead we see handheld, we see iPhone, we see smartphone. Quite a difference going back over this last decade in health survey methods. I just had to throw this in there. Earlier this week, the Census Bureau and Director Bob Groves announced that the Census Bureau even is going to use this thing called the Internet, again representative of the technological change moving our industry forward. So we hope that we have raised many questions for you in your mind as you've listened to this presentation. We note also that there are many opportunities in using both social media and new technologies as we move forward. We've listed some of the ways here. I want to leave you with several questions that we want to look further into as we move forward, using both social media and new technologies. When you think about the entire framework of total survey error, what data quality issues must we examine when we're considering survey work using these new modes or platforms? How reliable and valid are the data collected through these modes? These are kinds of things that we'll be looking into in the near future. Second example is what additional research is being done on these platforms and these technologies in other fields, in adjacent fields? Can we gather information from marketing, from media studies, from health communications and human-computer interactions that will help inform us in the survey research industry? Another interesting question for us that we want to explore is, what can or will survey respondents share with us via these new modes, and how can we best tailor the request for this information? Most social media communication is interactive, and so we're wondering if in the future survey researchers will be expected to share information back. In other words, make it a two-way process instead of a one-way process, more interactive. What information can we learn about what motivates respondents? Why is it that respondents are willing to post information on Facebook or on Twitter that they are more reluctant to give us in a traditional survey application? Another question to consider, of course, is that the demographic profiles of users of these different platforms or different technologies are quite different than the general population. We have to examine how those subpopulations differ from the general population, from the benchmark, how we can think about representative samples using these particular platforms. And then lastly, I guess the piece that I want to emphasize is, again, the interactive nature of much of this communication and whether or not this is fundamentally changing the way people communicate or think about communicating, and how we as survey researchers can leverage that. To conclude, it is indeed an interesting time to conduct health surveys. Thank you.